Hi, this is Dr. Serena Satcher, and this month we're talking about lupus. And I've gotten quite a number of questions this month about lupus that I'm addressing here in these videos. So the next question is, what causes lupus, and is lupus hereditary? So there's not one cause that's known for sure for lupus. It was initially thought that genetics and family history played a large role. But now, in studying the microbiome, we know that there are certain viruses, bacteria, and other microbes that play a role in the development of autoimmunity and of lupus. Um, Also, it's felt that certain wavelengths of light may activate it in the skin, and as a side effect, drugs may play a role. In functional medicine, we look for root causes that contribute to autoimmunity, such as poor nutrition, nutritional deficiencies, toxicity, and stressors. So, what are some of the factors that cause us to develop lupus? Stress, genetics, family history, autoimmunity, toxic exposures, sun exposures, and medications. Stress, I think, is of utmost important, especially when involved looking at the mind, body, spirit. And what complications can occur as a result of having lupus? Well, I think we talked about in a previous episode that strokes, heart attack, kidney failure, mental health issues of all kinds, brain issues, skin, rashes, necrosis and scarring of the joints, pregnancy complications, bleeding complications, hip joint destruction called avascular necrosis, and cataracts. So thanks for joining me today. And you can find me on social media at Treat Yourself to Health and on my website at Treat Yourself to Health. Join me for the next question session.